Did you know that someone in the United States has a heart attack every 40 seconds? That's over 800,000 people every single year. But here's what's even more shocking. Nearly half of all heart attack deaths happen before the person even reaches the hospital. The difference between life and death often comes down to what you do in those first critical minutes. Today, I'm going to share 7 life-saving tips that could literally save your life or the life of someone you love during a heart attack. Some of these might surprise you, and one of them goes against what most people think they should do. So stick around because this information could be the most important thing you learn today. Before we dive into these life-saving strategies, let's quickly understand what's actually happening during a heart attack. Your heart is essentially a muscle that needs constant blood flow to survive. When one of the arteries that supply blood to your heart becomes blocked, usually by a blood clot, part of your heart muscle starts dying from lack of oxygen. Time is everything here. The longer the blockage remains, the more heart muscle dies and the lower your chances of survival become. Now here's the first crucial tip that could save your life. Recognize the warning signs immediately and don't ignore them. We've all seen movies where someone clutches their chest dramatically and collapses, but real heart attacks are often much more subtle. Yes, chest pain is the most common symptom, but it doesn't always feel like crushing pain. Many people describe it as pressure, squeezing, fullness, or even just uncomfortable tightness in the center of the chest that lasts more than a few minutes or comes and goes. But here's what many people don't know. Heart attacks can present completely differently, especially in women. You might experience pain or discomfort in other areas like your arms, back, neck, jaw, or stomach. Some people feel shortness of breath, nausea, lightheadedness, or break out in a cold sweat. The key is not to dismiss these symptoms, especially if you're experiencing several of them together. Your body is trying to tell you something is seriously wrong. The second life-saving tip is to call 911 immediately. Not your doctor, not your family member, not an Uber. Call 911 first. This might seem obvious, but studies show that most heart attack victims wait over 2 hours before seeking help. They think the symptoms will pass, or they don't want to cause a fuss, or they're embarrassed that it might be a false alarm. Let me be crystal clear about this. It's better to be embarrassed about a false alarm than dead from waiting too long. When you call 911, paramedics can start life-saving treatment before you even reach the hospital. They carry medications and equipment that can begin opening blocked arteries and stabilizing your heart rhythm. Plus, when you arrive at the hospital by ambulance, you'll be fast-tracked to treatment. Emergency departments prioritize ambulance patients over walk-ins, which could save precious minutes when every second counts. Here's the third tip, and this one might surprise you. Take an aspirin if you have it available, but only after you've called 911. Aspirin helps prevent blood clots from getting bigger, which can help minimize heart damage. The recommended dose is 1 regular strength aspirin, which you should chew rather than swallow whole. Chewing gets the medication into your bloodstream faster. However, and this is important, only do this if you're not allergic to aspirin and you don't have any bleeding disorders. If you're unsure, skip the aspirin and focus on the other steps. The fourth critical tip is about positioning yourself correctly while waiting for help. Sit down and try to stay calm. If you're standing or walking around, you're making your heart work harder when it's already in distress. The best position is sitting upright in a comfortable chair or leaning against a wall. This position helps your heart pump more efficiently and can reduce the workload on your damaged heart muscle. Avoid lying flat on your back unless you feel faint, as this can make it harder for your heart to pump blood effectively. Now here's tip number 5, and this goes against what many people instinctively want to do. Don't drive yourself to the hospital. I know this seems counterintuitive because you want to get help as quickly as possible, but driving while having a heart attack puts both you and others at serious risk. Your symptoms could worsen suddenly, you could lose consciousness, or your judgment could be impaired. You're not just risking your own life, but the lives of innocent people on the road. If for some reason you absolutely cannot get an ambulance and someone else can drive you, have them take you to the nearest hospital with an emergency department, not an urgent care center or clinic. Most urgent care facilities aren't equipped to handle heart attacks and will just have to call an ambulance anyway, wasting valuable time. The sixth life-saving tip focuses on what to do while waiting for help to arrive. Try to stay as calm as possible and focus on slow, deep breathing. Panic and anxiety increase your heart rate and blood pressure, putting additional strain on your already compromised heart. I know staying calm during a heart attack sounds nearly impossible, but even small reductions in stress can help. If you have prescribed nitroglycerin for chest pain, you can take it as directed by your doctor, but don't take someone else's medication. Loosen any tight clothing around your neck, chest, or waist to help with breathing and circulation. If you're with someone, have them stay with you and keep track of your symptoms to report to the paramedics when they arrive. This information can be crucial for your treatment. Here's the seventh and final tip that could make the difference between life and death. If the person having a heart attack becomes unconscious and stops breathing normally, start CPR immediately. Many people are afraid to perform CPR because they're not trained or they're worried about doing it wrong, but hands-only CPR is better than no CPR at all. Place the heel of one hand on the center of the chest between the nipples. Place your other hand on top and interlace your fingers. Push hard and fast, at least 2 inches deep at a rate of 100 to 120 compressions per minute. That's roughly the beat of the song, Stayin' Alive. Don't be afraid to push hard. Broken ribs heal, but brain damage from lack of oxygen doesn't. If there's an automated external defibrillator available, use it. These devices are designed to be used by anyone and provide voice prompts to guide you through the process. They're increasingly common in public places like airports, schools, and shopping centers. Now, let me share something that ties all of these tips together. The reason these strategies are so effective is that they all focus on one critical goal: getting professional medical help as quickly as possible while minimizing further damage to the heart. Every minute of delay increases heart muscle death and decreases your chances of survival. But here's what's really important to understand. Surviving the initial heart attack is just the beginning. The actions you take in those first few minutes can determine not just whether you survive, but what your quality of life will be afterward. Quick action can mean the difference between a full recovery and permanent heart damage that affects you for the rest of your life. The best defense against heart attacks, of course, is prevention. But if you or someone you're with is having a heart attack, these 7 tips could save a life. Remember, recognize the signs quickly, call 911 immediately, consider aspirin if appropriate, position yourself correctly, don't drive, stay calm while waiting for help, and be prepared to perform CPR if necessary. I hope you never need to use this information, but if you do, you'll be prepared to take the right actions when every second counts. Share this video with your family and friends because you never know when this knowledge might save someone's life. What other emergency medical situations would you like me to cover? Let me know in the comments below, and remember to subscribe for more life-saving health information.